So to begin with, I think I will be taking the development part of the eye. I have gone through some of the questions. With the questions, I was able to, just reconstruct what is the theory part which is required for you people. If you look at this diagram, okay, this is the diagram. This shows how the eye develops from starting from the zygote. Once the zygote is formed, that will form into a morula. The morula will give rise to blastocyst. The blastocyst is nothing but is just what you call the cells
Implanted.
will rearrange. Hello.
Yes, sir. Implanted.
Yes, yes. See, the blastocyst will rearrange, the cells will rearrange themselves and they will form a T-layer structure, multi-layer structure known as a gastrulation. Okay. This is the cross section, how the structure looks like. Okay. This blue layer is nothing but a surface ectoderm. And you can make out this is the red part, this is the mesoderm, and the inner part, this is the endoderm. Okay. The surface ectoderm will invaginates and forms the neural tube, and there is a green structure. Again, this arises from the surface ectoderm. Okay, this is the neural crest cells. All the cells, they will rearrange and they will differentiate themselves. Once they are differentiated, you have to remember the eye development starts at the 22nd day. And normally, suppose this is the forebrain. In the forebrain, the first part to appear in the development of the eye will be the optic vesicle. Okay, this is the optic vesicle. And you can make out these are the cells, how they migrate and how they differentiate themselves. Okay, the green structure is nothing but a neural crest cells, and this is the orange structures are the mesoderm, and the blue structure are the neuroectoderm. Once this is understood, next will be how the development occurs. The first structure to develop will be the optic nerve. Okay, first there will be optic vesicle formation. Okay, this is the what you call the sagittal section. This is the neuroectoderm. From the neuroectoderm, a vesicle arises. That next to that there will be a, what you call the surface ectoderm. Okay, this surface ectoderm invaginates into the optic vesicle, and that will completely get detached from the surface ectoderm. Okay, once this is detached, that will form something known as a lens placode. This helps in the formation of the future lens. Okay, so the lens arises from the surface ectoderm. This is the blue structure is a surface ectoderm that will get disconnected from the rest of the part to form the lens, what you call the lens vesicle. This blue part is a optic vesicle that invaginates, and this green structure is nothing but a neural crest cells. Okay.
Yes, sir.
This neural crest cells give rise to what you call the meningeal sheath of the optic nerve. Ectoderm, the neurosensory retina and the retinal pigmented epithelial cells arises from the neuroectoderm. Okay, this is just a continuation. If you just remember this diagram, you'll be able to you can in the exams easily you can remember what are the structures which arises from the different parts of the germ cells. Okay, so basically the optic nerve, neuroectoderm give rise to the optic nerve, that is the axons and the glial tissue. Okay, and the neural crest cells give rise to the meningeal sheath. Okay, these are the green cells are nothing but the neural crest cells. This is the blue part is nothing but the optic nerve. Next, what are the structures which arises from the surface ectoderm? Okay, I told you in the beginning, the lens arises from the surface ectoderm because that will get impinged into the neuroectoderm. Then all the epithelium of the skin, caruncle, and all the lacrimal gland and also the cilia of the eyelid comes from the surface ectoderm. Lacrimal drainage system arises from the surface ectoderm. Conjunctival epithelium arises from the surface ectoderm because this was the question asked previously. That's why I'm covering these part. Next is lens, we have discussed earlier. These are the structures which arises from the surface ectoderm. Next, what are the structures which arises from the neural crest cells? Okay, the neural crest cells are very important. See, this is the surface ectoderm. Okay, basically the neural crest cells are differentiated from the surface ectoderm. They will form themselves. These are the green cells are nothing but the neural crest cells, and this is the neural tube. Okay, these green cells can differentiate into Schwann cells, sympathetic ganglia, dorsal root of ganglions, and also they will form the melanocytes. Okay. Coming to the formation of the cornea. Okay. Now the cornea arises from the two parts. The epithelium, okay, corneal epithelium that has to regenerate every time. So that will arise from the surface ectoderm. Okay. Next, the corneal stroma and the endothelium arises from the neural crest cells. Okay. Here the important point is, see, this dark blue color is nothing but the epithelium. This light, what you call the blue color is nothing but the anterior segment. Okay, anterior chamber, what we call it as an anterior chamber. Anterior chamber, the which consists of the angle and also the iris, so what you call the corneal stroma and the endothelium arises from the neural crest cells. Okay, this you have to remember. Cornea has two parts. Epithelium arises from the surface ectoderm, and the stroma and the endothelium arise from the neural crest cells. Okay, and also the what you call the trabecular meshwork arises from the neural crest cells. Okay, when you especially in the ophthalmology, one of the the anterior segment dysgenesis. There is a syndrome called anterior segment dysgenesis, also known as a cristinomas. Okay, this anomaly occurs due to the abnormality in this neural crest cells migration. Okay, this is the retina. These are the primitive retina I'm talking about. This is the retina which arises from the neuroectoderm. This is the lens, the what you call the embryonic lens. This arises from the surface ectoderm. Now we have an iris. If you look at this diagram, okay, see in this diagram, this orange color is retina. You have a ciliary body and you have an iris tissue. Okay. Retina arises from the neuroectoderm. Ciliary body, that is especially the epithelium, is just a continuation of the retina. So that also arises from the neuroectoderm. Similarly, the iris epithelium also arises from the neuroectoderm. So if you keep this point in mind, you can definitely remember everything. Okay. See, the iris has stroma. The anterior part is the stroma. The posterior part is a epithelium. Okay. The epithelium has pigmented and a non-pigmented epithelium. As I told you, this epithelium is continuation of the ciliary body epithelium that further continues backwards as a neurosensory retina. So therefore, this epithelium arises from the neuroectoderm. Got it? Next, you have iris, dilator, and a constrictor muscles, which also arise from the neuroectoderm. Then you have what you call the because iris is a pigmented tissue which has melanocytes. So the melanocytes arise from the neural crest cells that I told you in the beginning. Okay. So stroma has what you call the vascular. It's a highly vascular structure. Any vascular structure arises from the mesoderm. Got three structures. You have to remember. I'm audible. Hello.
Yes, sir.
Okay. So if you have any doubts, you can ask me in between. Okay. The neuroectoderm give rise to the epithelium, muscles. The neural crest cells give rise to the melanocytes, and the mesoderm give rise to the stroma. Okay, with the vascular part of the iris. Similarly, ciliary body, similar to the iris, you have a neuroectoderm which give rise to the epithelium, and the epithelium, which is a pigmented and the non-pigmented epithelium. Stroma arises from the mesoderm. Okay. Then you have a vitreous. The peculiarity of the vitreous is the vitreous arises from all the four structures. This you can remember, hopefully. Okay. Vitreous arises from all the germ layers, okay, which arise from the surface ectoderm, neuroectoderm, neural crest cells, and mesoderm. Okay. And if you remember, surface ectoderm, neuroectoderm, and the neural crest cells are basically the ectoderm cells. Okay. They will differentiate themselves as a different tissues. So basically the eye develops from only from ectoderm and a mesoderm, not from endoderm. That you have to keep it in mind. Okay. The vitreous has basically develops as a three types, basically the primary vitreous, secondary vitreous, and a tertiary vitreous. The primary vitreous will regress. Similarly, the secondary vitreous also undergoes the regression, but the tertiary vitreous which persists. Normally in the embryo, which has what you call the blood supply, which arises from the hyaloid artery, during the development, this hyaloid artery undergo regression. Okay, this is one of the potential question. What does the clocket canal contains? If they ask, you can tell it's a remnant of a regressed hyaloid artery is the answer. Okay, this is one of the if you remember, one of the anomalies of a vitreous development is the persistence of the hyaloid artery. Then one more question, like how the sclera develops. There are so many answers. I looked into some of the the MCQ books. They have mentioned it arises from the mesoderm, but actually, if you look into the development part and if you refer to the standard textbook, the this temporal part of only the temporal part of the sclera develops from the mesoderm, and rest of the part develops from the neural crest cells. Okay, if you remember this diagram, it's easy to understand. See, this this blue color is nothing but a optic nerve and the neurosensory retina, that is a neuroectoderm. This orange color in between is a choroid. Okay, this green structure is nothing but the sclera. If you look in the posterior part, this neuroectoderm gives rise to the meningeal sheath covering of the optic nerve. Anteriorly, this continues to form the sclera, okay, scleral coating. Similarly, in the anterior part, this becomes the stroma and the endothelium of the cornea. Okay, with this diagram, you should be able to remember everything. Okay, this dark blue color is nothing but the surface ectoderm, which give rise to the eyelids and the corneal epithelium and the conjunctival epithelium. Okay. Next, the choroid. Choroid is nothing but, again, if you know the anatomy of the choroid, again you can remember, you can easily remember how the structures are, develops. Choroid has two parts basically. It has a stroma and the blood vessels. Basically, the choroid is richly what you call the highly vascular structure, which has a stroma and the blood vessels. The blood vessels arise from the mesoderm, and the neuroectoderm give rise to the stroma. Okay. Next, The extraocular muscles, orbital tissue, the fat, especially the fat and the blood vessels of the orbit has a similar what you call the development. Here the extraocular muscles, these muscles arise from the neural crest cells. The muscle sheath and the tendon arise from the neural crest cells, and the muscle fibers arise from the mesoderm. Okay. Similarly, if you just compare with the orbital fat, okay, adipocytes arise from the mesoderm, the connective tissue and the rest of the fat arise from the neural crest cells. Okay, just you compare the muscles with the orbital fat. Okay, almost similar. Next comes the blood vessels of the orbit. Here again, the vascular endothelium arises from the mesoderm. The neural crest cells give rise to the muscles and the connective tissue. Okay, there is a little bit of similarity between all the structures. If you know the how it develops, you can remember everything. Okay, coming to some of the questions, based on the questions I was able to just reconstruct what theory part is essential for you people. And just if you look at these questions, you can answer all the questions, I think. Which of the following, this question was asked in AIMS 2013. Which of the following is not a derivative of a neuroectoderm? Not a
Ciliary muscle.
derivative.
Ciliary muscle.
Hello? Yes, absolutely. Very good. Okay. So basically, ciliary muscle arise from.
Neural crest.
See, again, ciliary. See, if you go in depth, it has a two parts, right? One is the stroma and the epithelium. Epithelium arises from the neuroectoderm. Okay.
Yes, sir.
Hello.
Yes, sir.
Ciliary epithelium arises from the neuroectoderm, but the muscles arise from the
Neural crest, sir. Neural crest, sir.
Okay. The second question. The surface ectoderm give rise to all the following structures except. This was asked in 2000, I think 2003 AIMS, and also in I think 2014. Surface ectoderm give rise to all the following structures except surface
Anterior layer of
ectoderm.
iris.
Pardon?
Anterior layer of iris.
Good. So basically, the lens arises from the surface ectoderm. Corneal epithelium from the surface ectoderm. What are the other structures which arise from the surface ectoderm?
Tarsal plate. Lacrimal gland.
The skin, basically the skin lining arises from the surface ectoderm. Okay. Third question. Following ocular structure is not derived from the surface ectoderm.
Sclera.
Yeah, good. Sclera arises from?
Sir, two parts from actually, sir, temporal part is mesoderm and other parts are neural crest cells, sir.
Yeah, good. So if you know the diagram, easily you can answer. Sclera, the temporal part arises from the mesoderm. The rest of the part arises from the neural crest cells. Okay. This is one more question. Corneal endothelium is embryologically derived from?
Surface ectoderm.
Pardon?
Surface ectoderm, sir.
No. The corneal endothelium arises from the. See, I
Sorry,
told
sir.
you,
Sorry,
right?
sir. Sorry, sir. Sorry,
See,
sir.
epithelium, corneal
Neural
epithelium.
crest.
See, you have to
Neural
remember.
crest.
Ha. See, I told you, right? The stroma and the endothelium arise from the crest cells. Okay. Almost
Yes.
the anterior, what you call the anterior chamber part develops from the neural crest cells, including the stroma, endothelium, and even the what you call the trabecular meshwork. The lining and the endothelium arise from the neural crest cells. Okay, rest of the part which develops from basically, and see, if you look at this endoderm, none of the structures develops from the endoderm. That you have to keep it in mind. Okay, in that way, this option is ruled out, completely ruled out. Okay.
Yes, sir.
Yeah. Coming to the next question, what is the conjunctival? What is the type of conjunctival epithelium? They mean to say basically you have four options. One is pseudostratified, stratified columnar, stratified non-keratinized squamous and transitional cells. This was asked in PJ 2005. Okay, anybody? Okay, see, if
St-
you
stratified non-keratinized squamous, sir.
just a minute. Okay. See, this is the just a chart or a table to show what are the. See, important thing is uh, the anterior you can make out conjunctiva, skin. You know, everyone knows it's a keratinized, stratified squamous epithelium. Okay, it's a keratinized skin, but with respect to the eye is concerned, you have a conjunctiva superficially, you have a cornea, and next to that you have a lens. Okay, the three important structures. Conjunctiva has basically three parts. If you just broadly, you can categorize as three parts. One arises from the tarsus, one from the fornix, one from the bulbar conjunctiva. Okay, bulbar is nothing but the conjunctiva which lines the sclera. Okay, that is a bulbar conjunctiva. Fornix, you know where exactly it folds. The tarsus, and if you look into the the type of cells, tarsus has a cuboidal type. It's all are stratified, but it's a cuboidal. But the fornix has a columnar, bulbar has a squamous type. Okay, you go from the tarsus, then the fornix, then into the bulbar conjunctiva. Okay, easy to remember. To begin with, cuboidal becomes a columnar, then it becomes a squamous. Okay. Similarly, the cornea has basically cornea has almost like a six layers. It's not a single layer, but cornea has a six layers. Okay. If you go back for a second, I think here one of the diagram. Okay, so this is the corneal cross section, how it looks like. Okay, cornea has almost like a six layers. The basal layer is almost like one or two layers, which is cuboidal in nature. Then you have around 2 to 3 layers of polygonal cells. Keep it in mind. The third layer is a squamous layer. The outer layer is nothing but a squamous layer. Okay, and this is the stroma, which is almost 90% of the corneal thickness. Okay, which has keratocytes and a collagen. Stroma is nothing but a collagen. How collagens are basically, they are arranged in a regular pattern. Okay, because the collagens are arranged in a regular pattern, because of which the light is, because of the homogeneity, the light doesn't get scattered, which passes through the cornea. Okay, and if you look into the diagram, this diagram, okay, this is again the cross section. This is the eyelid. This pink color structure is nothing but a conjunctiva, which is a palpebral conjunctiva. The at the margin, this is the tarsal part. At the junction, if you look at the superior apical part, is nothing but a fornix conjunctiva. The blue part is a bulbar conjunctiva, which just covers the eyeball. Okay. So the cornea has three parts. Basically, the basal layer, just a columnar cells. You have an intermediate layer, which has around 2 to 3 layers or wing-shaped cells. The superficial layer is around just one or two layers of squamous cells. Coming to the lens, lens has a peculiar arrangement. Lens has a capsule in the anterior surface. It has a lens capsule. Just beneath that has a single layer of metabolically active cells, which keep dividing and forms a what you call the lens fibers. Again, these lens fibers has a what you call the homogeneous arrangement, because of which the light can pass through that. Okay. The sixth question is, maximum density of goblet cells is seen in superior conjunctiva, inferior conjunctiva, nasal conjunctiva, or the temporal conjunctiva? This was asked in 2004 AIMS.
Nasal conjunctiva.
Very good. Okay. So basically, if you goblet cells, if you take all the cells of the conjunctiva overall, goblet cells is only around 10% of the all the cells, which are basal cells basically, and you see more in the tarsal part of the conjunctiva and also in the infero-nasal bulbar conjunctiva. Okay, there is a little bit trick in this question. Okay, they are asked in there are two options. Okay, you can get confused with inferior and the nasal. Okay, inferior refers to both. You can have a temporal and the what do you call the nasal part. So always better to go for a nasal conjunctiva. Okay.
Yes, sir.
So you have around 10% of all the cells of the conjunctiva is goblet cells, which are at the tarsal plate, more in the inferior nasal bulbar conjunctiva. That you have to keep it in your mind. Next, that will be in the plica seminolaris. Okay. The conjunctiva has two parts basically. One is the epithelial layer, then you have a substantia propria, also known as a adenoid layer, and this has a something known as conjunctival conjunctiva associated lymphoid tissue. Okay, this is a CALT. Okay, you have a malt. Okay, similarly you have something known as a calt. This is associated with conjunctival, okay, lymphoid tissue. What is the purpose of this cult? Is basically to regulate the allergy. Okay, any allergens that will be taken care by these cult cells. Coming to the blood supply, if you look into the blood supply, it's very easy to remember. Okay, you have two parts. Okay, for your understanding, bulbar conjunctiva and palpebral conjunctiva. Okay, palpebral conjunctiva is supplied by the blood supply from the eyelid, which is marginal arcade system and a peripheral arcade system. Okay, this marginal arcade system and a peripheral arcade system supplies the eyelid. The same blood supply supplies the palpebral conjunctiva. Similarly, for the bulbar conjunctiva, receives the blood supply from the anterior conjunctival artery, which is a branch of anterior ciliary artery. Okay, that you have to keep it in mind, because this question may be confusing, because see, majority of the ocular structures are supplied by the ciliary arteries, which are, if you take, for example, if you take iris, ciliary body, choroid, these are supplied by the posterior ciliary artery, which are long or short ciliary arteries. Okay, but the bulbar conjunctiva is supplied by the anterior ciliary artery branch, that is the anterior conjunctival artery. This anterior ciliary artery is a branch of muscular artery. Okay, are you getting?
Yes, sir.
Okay, anterior ciliary artery arises from the muscular artery. The muscular artery is supplied by the glands, which supplies the lateral lymphatics. If you look at this diagram, lymphatics again, okay, I've made it in two different colors. You have a red dots and you have a green dots. Okay, and I have divided the surface like this: a superior half and an inferior half. Again, the superior half is divided into medial 1/3 and a lateral 2/3. Similarly, the inferior half is divided into medial 2/3 and a lateral 1/3. Okay, the superior 1/3 and the inferior 2/3 drain into the submandibular nodes. Okay, the superior 2/3 and the lateral 1/3 drain into the preauricular nodes. Okay, this is the right eye for your understanding. Okay, the lateral part, almost the lateral part, drain into the preauricular nodes. The medial part drain into the submandibular nodes. Okay, this, and to continue this, okay, you have something known as a, this is the stroma, this is the descemet membrane. Next to the descemet membrane, now recently one the layer has been recently discovered, that is
Pre-descent.
Duas layer.
hello,
Pre-descent.
hello,
Pre-descent membrane.
yeah, what is the name of that?
Duas
Pre-descent.
membrane.
Ah,
Sir,
someone is
pre-descent
answering.
membrane.
Someone is answering. What is the name of that pre-descemet membrane?
Duas membrane, sir.
Very good, excellent. Okay, that could be one of the potential question. Duas layer, though it's a controversial, but now recently it has been detected. Okay, these endothelial cells. Okay, if you look into these cells will regenerate. Okay, the corneal epithelial cells throughout the life they will be regenerate. Okay, they will straighten and they will regenerate. But if you look into the Bowman's membrane, okay, this has a property to, once this is damaged, it doesn't regenerate. Okay, and you have endothelial cells. Endothelial cells are fixed. Okay, the numbers are fixed, and throughout the life they will keep reducing over a period of time. Okay, they are hexagonal in shape, that you have to keep it in mind. And normally the corneal transparency is because of these endothelial cells which pumps the water out of the stroma. Okay, and these endothelial cells have a sodium potassium pump. Okay, coming to the questions, some questions regarding the cornea. Okay, this
Cornea.
question was asked in 2013. Bowman's membrane is seen in,
Cornea.
easy question. I think it's a cornea. Next, all are true regarding the cornea except endothelium helps in maintaining the dehydrated state. Oxygen is mostly derived by the epithelium directly from the air through the tear film. Glucose supply for the corneal metabolism is mainly derived from the aqueous. Corneal thickness is more at center than the periphery and richly vascular. This question was asked in PJ 2015. So, what are the answer?
Sir, richly vascular.
Correct. Then,
And
as I told you in the beginning, see the endothelium is a pump basically. Okay, this will just pump the water out of this stroma to keep it dehydrated state. Okay,
yes, sir.
cornea receives what you call the nutrition in the form of oxygen and the glucose. Oxygen, it derives the oxygen from the air through the tear film. Okay, similarly the glucose which arises from the what you call the endothelium which supplies the glucose to the stroma, this glucose in turn arises from the aqueous humor. Okay, and again if you look into the fourth option, corneal thickness is more at the center than the periphery. This is the wrong answer. Okay,
Peripheral thickness.
corneal thickness is more at the limbus and in the periphery, but in the center it's thin. And how much is the corneal thickness in the center?
0.52.
Okay, you go according to the microns. Okay, see,
Like
if you take the what is the adult corneal central corneal thickness, on an average it's around, it's easy to remember, 545. Okay, 545 microns. Okay, in the adult it's a 545 micron in the center. In the periphery it's almost like a 1 millimeter. It's almost like 0.9 millimeter. Okay, and cornea is the one structure in the eye which is highly avascular. Except for the periphery, the central part of the cornea is a avascular structure. That's why graft transplant in the whole body is the cornea. Okay, cornea is highly avascular. So it can be, the transplantation is more widely done. So the answers are corneal thickness more at the center than the periphery and the richly vascular. Okay, these are the two options. True about the cornea is, if you have any doubt, let me know. We'll move to the next question. Okay, what is the true statement about the cornea in this question? This was asked, I think, quite frequently. I think many times this question has been asked, and recently, I think in 2013 also they were asked. True about the cornea is stratified non-keratinized vascular epithelium. The refractive index is 1.37. Receives the nutrition from the atmosphere and the aqueous humor. The corneal transparency is maintained by the metabolic activity, basically the activity of a descemet membrane layer. Okay. So what do you think is the answer in this question?
So refractive index 1.37.
1.37.
See, just sometimes we can answer just with a common sense. I told you, right, in the beginning, I told you, the corneal transparency is maintained by the metabolically active descemet membrane layer. Okay. See, the descemet membrane is nothing but a membrane which is secreted by the endothelial cells. Okay. It's just a basement membrane. Okay, it just, it demarcates between the stroma and the endothelial cells. It doesn't have any role. Okay, so basically, suppose if your fourth option was like corneal transparency is maintained by metabolically active endothelial layer, then it would have been a correct answer. Okay. Now it's basically, they have mentioned it's a descemet membrane. Descemet membrane doesn't have any role except for the structural stability to the cornea. Okay. If you look into the refractive index, see, to begin with, next time I will show you. Next time, this is just what you call the trial class. Next time we will go in depth and I will show you all the details, like what are the corneal curvature. Okay, everything we will discuss. These are just a class, like how we are going to work out, and we'll discuss. The refractive index is correct. If you go into the decimal points, actually it's 1.376. Okay. Still, it holds correct. So this is 1.37 is a correct answer. Again, the cornea we have discussed, it's a stratified non-keratinized avascular epithelium. That is absolutely right. This the option B is also correct. The C option receives nutrition from the atmosphere and aqueous humor. That is also correct answer.
Yes,
So
sir.
the only option which is wrong here is the corneal transparency, which is maintained by the descemet membrane. Okay, except for D, A, B, C are the correct answers. Okay, what is the refractive index of air? Anybody?
Sir?
What is the refractive index of air? 1. Okay.
Sir.
Hello.
Yes, sir.
The refractive index of air is 1. Okay. Any solid structure will have a more refractive index than the air. Okay. Suppose cornea has 1.376. Similarly, the aqueous humor and the vitreous has the same refractive index. Okay. Next time I'll show you, what you call the table where you can how to remember the refractive index of all the structures of the eyeball. And if you look into the anterior cortex and the posterior cortex of the lens has a same refractive index, but the nucleus has a different refractive index. Okay. If you take the anterior segment from cornea till the lens, nucleus has a more refractive index. Okay. Anybody has a doubt? If you have any problem, we will just discuss. If you have any doubt, let me know.
Okay.
Now coming to the last question. Okay. True about the adult cornea. Horizontal diameter is 12 millimeter. Horizontal diameter is 10 millimeter. In megalocornea, diameter is more than 12 millimeter. In microcornea, the diameter is less than 10 millimeter. The fifth option, vertical diameter is more than the horizontal diameter. Okay. Now, cornea, if you look into the cornea, always when we talk about the diameter, it's always the horizontal diameter. That you have to keep it in mind. Okay.
Yes, sir.
The diameter is more than the vertical diameter. Okay. The horizontal diameter is, it's around 11.7 millimeter. Almost 12 is considered to be normal here. Okay. Decimal sometimes is very difficult to remember. So that's why sometimes they'll put it in, just a round figure. So the horizontal diameter is 12 millimeter. This is a correct answer. Then you have a option B, that is a horizontal diameter, which is 10 millimeter. So I told you the horizontal diameter is 12 millimeter is a correct option. Vertical diameter is normally it's around 10.5 to 10.6. Okay. So the B option is a wrong answer. When do you call it as a megalocornea? When the diameter is more than 12 millimeter. Anything which is beyond the normal range is considered to be abnormal. So when the diameter is more than 12 millimeter, it's a megalocornea. When the diameter is less than 10 millimeter, it's called the microcornea. When they say micro or a megalocornea, always remember this with respect to the horizontal diameter. When nothing has been mentioned, always you have to keep it in mind the megalocornea and a microcornea with respect to the horizontal diameter. Okay. For all practical purpose, always they will take horizontal diameter as a criteria. Okay.
Yes, sir.
Next, okay, the last option is vertical diameter, which is more than the horizontal diameter. This also I told you. Horizontal diameter is more than the vertical diameter. So this is a wrong option. Okay. So the first one is a correct option. Second is a correct
Wrong.
third is correct option, and a fourth is a correct option. B and E are the wrong answers. Okay.
Yes, sir.
Sorry, this time I was not able to prepare the, the at least the theory part because I was busy with some work. So next time I will ensure, I think we will discuss with all the diagrams, like the little bit of theory. If you want, if you are willing and if you are interested to know the theory part, definitely next time I'll put the theory part also, so that I can, just show you the tabular column, how, like, what are the, how do you, just compare. Suppose if you take a adult eyeball versus a newborn eyeball, what are the, the different parameters, and how do you compare, and what is the normal range for a newborn baby, and what is the normal range for an adult. Okay, if you know these things, you can answer well in the exams. Okay, any suggestions from you, or if you have any doubt, let me know. Anybody?
No doubt, sir.
Roshan, who
No
all
doubt,
there?
sir. No doubt, sir.
Okay. Any suggestions from your side? Let me know, like, how do you like to have a class? This is okay, or still you want anything you want to go in depth? Anything you want to add? Any Any suggestions? Roshan?
Sir, no problem, sir. It's correct. A little bit, if you add some little bit theory, and it will be more beneficial to us, sir.
Perfect, perfect. Maybe in the next class, I will show you the slides because I had a little bit of work. I was not able to prepare, okay, the slides. So next time I will put all the slides, okay?
Okay, sir.
Okay, with this I will conclude my talk. Okay, thank you. Thanks a lot.
Thank you.
Printo,